Hello, nice to meet you. I would like to introduce our study about clinical characteristics and intrauterine vertical transmission potential of COVID-19 infection in 9 pregnant women. In this study, the clinical records, laboratory results, and the chest CT scans were retrospectively reviewed in 9 pregnant women with laboratory-confirmed COVID-19 pneumonia from January 20th to January 31st, 2020. The evidence of intrauterine vertical transmission was assessed by testing for the presence of the coronavirus in amniotic fluid, cord blood, and neonatal pharyngeal swab samples. The breast milk samples were also collected and tested for the virus after the patients had their first lactation. In our study, all 9 patients had a cesarean section in their 3rd trimester. 7 patients presented with a fever. Other symptoms like cough, myalgia, and malaise were also observed. Fetal distress was monitored in 2 cases. 5 of the 9 patients had lymphopenia. No neonatal asphyxia was observed in our study. Amniotic fluid, cord blood, and neonatal pharyngeal swab samples and breast milk samples of the 6 patients were tested for the coronavirus, and all samples were negative for the virus. Thus, our study showed that the clinical characteristics of the COVID-19 pneumonia in pregnant women were similar to those for the non-pregnant adults who developed COVID-19 pneumonia. Findings from this small group of cases also suggested that there is currently no evidence for intrauterine infection caused by vertical transmission in women who develop COVID-19 in their late pregnancy.